This is Anirban Sinha. So I work at the University of Amsterdam, and also I'm a visiting scientist at the University Hospital in Basel in Switzerland. So I'm here at the European Respiratory Society Congress. I'm also participating as a speaker, and also at the same time I'm also chairing a few sessions. So a couple of sessions that I chaired yesterday were really interesting. One of them was on mobile and electronic health. The other one was on exploring different mechanisms of airway disease monitoring. So I feel that there has been a renewed interest in the electronic and mobile health in research studies, which is very important because I think this is the next way to go, the next thing that is going to happen. And I see a lot of people across, our researchers and clinicians across the entire globe. They are focusing their research and also money in doing electronic and mobile health analyses. And so they have developed various devices whereby they can record and also analyze the medical health record data. So of which a few were really interesting. Was like there were a few abstracts based on which we could see that they were analyzing a lot of respiratory sounds, and they were being directly transmitted to the people who are analyzing those sounds, and based on the sounds, based on using different machine learning and artificial intelligence algorithms, they could differentiate different classes of asthma, healthy, different phenotypes. That's also good. And at the same time, they were also doing a lot of analyses based on telemonitoring, based on which they can guide the adherence to therapies and all these things. This is also very, very important because we have been talking about it for quite some time, but this year there has been a separate task force that has been created, and I see a lot of very, very interesting work, and I'm also a member of that. I have a discussion tomorrow again on this health, and then I would try to propose ERS to have a separate symposium. This year it's just a small effort. They have organized rather a small M and E health, mobile and electronic health 1 and 2, but then not as a symposium, but then if it is in a symposium, that would be really good. And I think that is really the way we want to go in future, rather than going to the patient home or the patient coming to the clinic. If we can monitor them over time, that would be really good. And with these new guidelines at the European Council coming along with data privacy and protection, I think it's very, very important that those data privacy guidelines and rules are maintained. And a lot of these different research organizations have, what I saw was they are affiliated and connected to the legal department in their institute, which are basically following all the procedures and checking if everything is okay or not. But as you pointed out, this is very important because the patient data protection and privacy is one of the most major criteria trust that ERS is also giving. Like it has to be anonymized, it has to be locked, it has to be layered in several ways so that there is no way you can go back to the patient records. It's just the data that you have, which is totally anonymized in several layers. Yeah.